The deadly secret. No one tells you about sleeping after 70. Did you know that you may be cultivating habits before bed that silently put your life at risk? What if by lying peacefully in your bed, you were unconsciously paving the way for a heart attack? Wouldn't what seems harmless in your nightly routine actually sabotage your health? These questions may seem alarming, but they are extremely necessary. Especially after the age of 70, the body undergoes changes that make certain nocturnal behaviors truly dangerous. Do you wake up tired even after a full night's sleep? The truth is that millions of Americans are unconsciously shortening their lives through seemingly harmless habits. Do you feel dizzy when you get out of bed, or have you noticed changes in memory? Do you have trouble breathing at night, or do you sleep with the television on? These signs can be more than just discomfort. In this content, we will reveal the 12 silent habits that dramatically increase the risk of death during sleep in older adults. Let's get started. 1. The device that's killing your heart while you sleep. Sleeping with your cell phone next to your bed has become an almost universal habit. Many people use the device as an alarm clock to listen to relaxing music, or even as a companion in the early hours. But what few know is that this seemingly innocent practice can bring serious health risks, especially after the age of 70. The first danger is constant exposure to the blue light emitted by the cell phone screen. Even if the screen is off, notifications, calls, and flashing lights during the night can interfere with the natural sleep cycle. Known as circadian rhythm, blue light inhibits the production of melatonin, the hormone responsible for inducing deep sleep. Without this deep rest, the body cannot regenerate properly, increasing the risks of cardiovascular disease, cognitive changes, and even dementia. Recent studies by the American Heart Association show that nighttime exposure to electromagnetic radiation can increase the risk of cardiac arrhythmias by up to 40%. In addition, there is a growing warning about continuous exposure to electromagnetic waves emitted by cell phones, even when they're in standby mode. Some studies suggest that the accumulation of this exposure over time can impact the functioning of the nervous system and increase oxidative stress in brain cells. Although there is still no absolute scientific consensus on the long-term effects, the potential risks warrant caution, especially in the elderly who have greater sensitivity to environmental stimuli. To reduce these risks, experts recommend that the cell phone be left away from the bed, preferably outside the room or in airplane mode. The ideal is to keep the sleep environment free of electronic stimuli, but get ready because the next habit we're going to reveal can literally make you pass out in the middle of the night. 2. The dangerous movement that causes fatal falls at dawn. Getting out of bed in the middle of the night sounds simple, but for those over 70 years old, it can become a real minefield for health. Have you ever felt dizzy, darkened vision, or a slight imbalance when getting out of bed? These signs may be a consequence of a problem known as postural hypertension. It is a sudden drop in blood pressure when changing positions quickly, especially when going from lying down to standing. The body takes a few seconds to adapt, and in this interval, there may be a lack of blood in the brain, causing dizziness, fainting, and in many cases, serious falls. Studies show that nocturnal falls are among the main causes of fractures in the elderly. Hip fractures are the most common and also the most dangerous. A simple fall can result in long hospitalizations, loss of mobility, dependence, and in more serious cases, even lead to death. The risk increases even more when the environment is dark, the floor slippery, or if the person is dehydrated. Often the use of blood pressure or sleep medications can also contribute to this imbalance. And the most worrying thing is that a good part of these falls could be avoided with small changes in behavior. Getting up slowly is the first essential attitude. When you wake up, sit up in bed and wait a few seconds before getting up completely. This time is enough for blood pressure to stabilize and blood to circulate properly to the brain. Another important measure is to keep a soft light in the bedroom or on the way to the bathroom. Avoid totally dark environments as this further compromises balance. Wearing non-slip shoes and fixed mats also helps prevent slipping. And never underestimate hydration. Taking small sips of water throughout the day keeps circulation working well. What comes now will shock you even more because we will talk about remedies that many consider saviors. 3. The pill that seems to help, but is destroying your body. Taking a pill before bed has become routine for many seniors, whether to fight insomnia, relieve pain, or control blood pressure. The nocturnal use of medications seems a safe and even necessary practice. But do you really know what's going on with your body while you sleep on these drugs? The big problem is that some common medications, especially those called sedatives or tranquilizers, can affect vital functions during sleep, such as breathing and blood circulation. Drugs such as diazepam, clonazepam, and others of the benzodiazepine class act directly on the central nervous system, reducing brain activity to induce sleep. However, this same action can reduce the respiratory rate, cause apnea, and increase the risk of nocturnal respiratory arrests, especially in those who already suffer from heart or lung problems. According to the Food and Drug Administration, about 30,000 Americans die annually from complications related to the inappropriate use of sleep medications. In addition, these medications increase drowsiness the next day, cause mental confusion, and reduce reflexes. The result is a higher risk of falls when waking up, loss of autonomy, and even the onset of dementia. Another group of worrisome medications are antihypertensives taken at night. In some cases, they can cause a sharp drop in blood pressure during sleep, reducing blood flow to the brain and heart. This imbalance can lead to silent ischemia, arrhythmias, and in extreme cases, stroke or heart attack while the person sleeps. There are also anti-inflammatories taken to relieve joint pain before bed. Continued use of substances such as ibuprofen or diclofenac can put a strain on the kidneys and liver, affecting the elimination of toxins and impairing the balance of the body. To reduce these risks, the first step is to never take medication on your own. Talk to your doctor about the real need for each medication, and if there are safer alternatives for the night. But wait until you know the next habit, because something as simple as holding urine can be silently harming your kidneys. 4. The emergency signals your body screams, and you don't listen to your body talks to you at night. But are you listening? Chest pain, shortness of breath, irregular heartbeat, or feeling suffocated can feel like nightmares. But in fact, they are emergency signals that your body is sending. After the age of 70, the cardiovascular system becomes more vulnerable, especially during sleeping hours. It is during the early hours of the morning that many heart attacks and strokes happen silently. Blood pressure naturally decreases during sleep, but in some people this drop can be excessive, dangerously reducing blood flow to vital organs like the heart and brain. On the other hand, some people experience pressure spikes during the night, especially between 3 and 6 o'clock in the morning, when the body prepares to wake up. Studies by the American Stroke Association show that 60% of strokes in people over the age of 70 occur during sleep or in the early hours of the morning. Other important signs include cold sweats, nausea with no apparent cause, and pain in the left arm or jaw. These symptoms can be subtle in older adults, who often mistake them for indigestion or tiredness. Sleep apnea also sends clear signals: loud snoring, pauses in breathing, and waking up with a feeling of choking. Each interruption in breathing forces the heart to work more intensely, increasing the risk of arrhythmias, hypertension, and cardiovascular events. If you or your partner notice these signs, it's critical to seek medical evaluation immediately. Tests such as electrocardiogram, Holter, and polysomnography can identify problems before they become fatal. Monitoring blood pressure at home is also a valuable tool for detecting dangerous changes. Remember, timing is crucial when it comes to cardiovascular emergencies. And now get ready to find out how holding urine could be causing irreversible damage to your kidneys. 5. The intimate habit that's slowly destroying your kidneys. How many times have you woken up during the night wanting to go to the bathroom but preferred to hold on so as not to get out of bed? This behavior, common to many people, may seem harmless, but after the age of 70, ignoring the urge to urinate at night can cause serious damage to your health. With advancing age, the functioning of the kidneys becomes more sensitive. They continue to filter blood throughout the night, but the bladder's ability to store urine decreases. When we hold urine for too long, we increase the pressure inside the bladder. This can lead to the reflux of urine towards the kidneys, favoring urinary infections and, in more serious cases, kidney failure. In addition, This accumulation can cause bladder irritations, leading to inflammation, a feeling of pain when urinating, and increased urgency during the day. Research from the National Kidney Foundation shows that holding urine regularly can increase the risk of kidney stones by up to 50% in older adults. More so, retaining urine frequently can also affect sleep. The discomfort causes the body to remain in a state of alertness, making it difficult to enter the deep stages of sleep. Who are the most repairing? Fragmented sleep, in turn, is directly linked to disorders such as depression, memory loss, hormonal imbalances, and increased risk of cardiovascular disease. Many elderly people avoid getting up to urinate for fear of falls, especially if the environment is dark or if there is already a history of accidents. Therefore, it is essential to adopt simple safety measures, such as keeping a nightlight on. Install grab bars near the bed or bathroom and wear slippers. Another important tip is to avoid consuming liquids in the 2 hours before sleep. During the day, it is essential to stay well hydrated, but at night it is necessary to balance this consumption so as not to overload the bladder. If you feel a frequent need to urinate at night, it is worth talking to your doctor. There may be some condition behind this symptom, such as prostatic hyperplasia, urinary tract infection, or hormonal changes. The next habit will surprise you because it's related to something we all find comforting. 6. The thermal trap that attacks your heart. During the night. On cold days, it is common to want a warm and cozy environment to sleep. Heavy blankets, closed windows, heaters on, everything seems ideal for a good night's sleep. But is sleeping in a very hot environment really safe, especially after the age of 70? The answer may be surprising. During sleep, the body naturally lowers its internal temperature to reach the deeper, more restorative stages of rest. This cooling is essential for the proper functioning of metabolism, for cell repair, and for memory consolidation. When the environment is very hot, this thermal regulation process is interrupted. The body has to work harder to try to dissipate heat, and this extra effort puts the heart on alert. Studies show that very hot environments at night can increase heart rate and raise blood pressure. This combination is especially dangerous for older adults who are already more prone to cardiovascular disease. In addition, excessive heat can cause nighttime dehydration. When sweating during sleep, the body loses important fluids and the blood tends to become more viscous. This thickening of the blood increases the risk of thrombosis, stroke, and silent heart attacks at night. Another problem that is little noticed is that a stuffy environment reduces air quality. With little circulation, the environment is more loaded with carbon dioxide and other pollutants. This can make it difficult to breathe, especially in those who have lung problems such as COPD or asthma. To protect health, the ideal is to keep the room at a temperature between 18 and 22 degrees Celsius. Avoid blankets that are too heavy and bedding that retain excessive heat. Prefer lightweight and breathable fabrics such as cotton. If possible, use fans or humidifiers to keep the air circulating. Leaving a window crack open also helps to balance the temperature and improve air quality. Sleeping in a well-ventilated environment at the ideal temperature is more than comfort. It is a vital protective measure for your heart and brain. And now get ready, because in the next habit, we're going to talk about a seemingly innocent supper that may be paving the way for a silent heart attack. 7. The killer dinner that prepares your body for death. A tasty meal at the end of the day seems like the perfect end to a good night's sleep. But is that hearty dinner or bedtime snack helping or hurting your heart? For those over 70 years old, this habit can be much more dangerous than you might think. With advancing age, metabolism slows down and digestion slows down. In addition, the cardiovascular system is more sensitive to overloads, especially at night, when the body should be resting and recovering. Eating heavy foods before bed, such as pasta, fried foods, fatty meats, or sweets, forces the body to keep working while you sleep. The stomach needs to digest, the liver needs to process, and the pancreas has to deal with rising blood sugar. Meanwhile, the heart that should be resting is forced to pump more blood into the digestive system. This extra effort can generate blood pressure spikes, arrhythmias, and even silent heart attacks during sleep. In addition, evening meals high in fat and refined carbohydrates increase the risk of gastroesophageal reflux, When a person lies down right after eating, stomach acid can back up through the esophagus, causing burning, coughing, and, in more serious cases, respiratory problems, such as aspiration pneumonia. This reflux is also related to episodes of sleep apnea, a disorder that affects breathing and further overloads the heart. Fortunately, a few simple changes can drastically reduce these risks. Avoid eating in the 3 hours before bedtime. Give preference to light meals with vegetables, whole grains, and lean proteins such as grilled chicken or fish. Easily digestible foods help the body enter a resting state more easily. If hunger strikes before bed, opt for a light snack. A fruit, a natural yogurt, or a handful of nuts are good options. With these choices, you protect your digestive system, allow your heart to rest, and ensure a more peaceful night's sleep. But now you're going to find out how a simple light could be destroying your brain. 8. The deadly enlightenment that destroys your brain. While you sleep, many people have the habit of leaving a light on in their bedroom at night. Whether for fear of the dark, convenience when getting up, or simply out of habit, this practice seems harmless. But science shows that sleeping with any kind of light can directly interfere with your health, especially after the age of 70. During the night, the brain needs total darkness to produce melatonin, the hormone that regulates sleep and signals to the body that it's time to rest. The presence of light, even dim, deceives the body and reduces the production of this vital substance. Without adequate melatonin levels, sleep becomes shallow, fragmented, and less restorative. This imbalance affects not only rest, but also the functioning of the entire body. Studies show that exposure to light during sleep can increase the risk of hypertension, type 2 diabetes, obesity, and even some cancers. In older people, complete darkness deprivation is associated with a higher risk of neurodegenerative diseases, such as Alzheimer's and dementia. Another worrying effect is on the immune system. Without deep and uninterrupted sleep, the body's defense cells do not renew themselves properly, which makes the body more vulnerable to infections and inflammation. In addition, continuous exposure to light during sleep affects mood, memory, and ability to concentrate the next day. But it's not just bright light that hurts. Those bluish lights from electronic devices, such as televisions, digital watches, or LED chargers, also harm the sleeping brain. Therefore, it is essential to make the bedroom a dark and quiet environment, favoring quality rest. The tip is simple. Turn off all the lights before bed. If you feel the need, use a night light with an amber hue, which interferes less with melatonin production. Blackout curtains also help block external glares. Sleeping in the dark is more than comfort. It's an essential preventative measure to protect your mind, your heart, and your longevity. And in the next habit, you'll understand how the position you sleep in can silently increase your risk of stroke. 9. The position that blocks your blood and causes silent spills. Sleeping seems to be the safest time of the day. But for those over 70 years old, even the position in which they lie can pose a risk to health and even life. Have you ever stopped to think about whether the way you sleep is helping or hurting your body? Many people maintain the same sleeping position for years, without imagining that it may be affecting blood circulation and oxygenation of the brain. Sleeping on your back, for example, can be especially dangerous for seniors who have sleep apnea, high blood pressure, or heart problems. In this position, the tongue and throat tissues can partially obstruct the airway, reducing airflow and lowering blood oxygen levels. The consequence is that the heart and brain start to work under pressure, which increases the risk of arrhythmias, heart attacks, and strokes during sleep. Even those who sleep on their side should be aware. Always sleeping on the right side can hinder venous return. In other words, the blood has more difficulty returning to the heart. This extra effort can overload the cardiovascular system and favor the accumulation of fluids, especially in the legs and feet. The position most recommended by experts is to sleep on the left side. In this posture, the heart works with less effort, the blood circulates more fluidly, and the digestive system is also benefited, reducing the risk of reflux and heartburn. In addition, this position improves cerebral oxygenation, reducing the chances of ischemic events such as stroke. To adapt to this new way of sleeping, some strategies can help. Use a pillow between your knees to align your spine and prevent back pain. Place another pillow behind your back to prevent you from turning over during the night. And if you feel reflux, slightly raise the head of the bed. Changing your sleeping position may seem like a small detail, but it can make a huge difference to your cardiovascular and brain health. And in the next habit, we're going to talk about a habit that many believe to be healthy, but that can turn into a silent trap. 10. The water that saves by day but kills by night. Drinking water is essential for health. Everyone has heard that we should stay hydrated throughout the day, especially as we age. But did you know that drinking too much water before bed can paradoxically put your life at risk? It seems contradictory, but science explains. As we age, the kidneys continue to function during the night, but the bladder's ability to store urine decreases. This means that by drinking large amounts of fluids before bed, the body will inevitably need to eliminate this excess during the night. And that's where the danger lies. By getting up several times at night to urinate, the elderly expose themselves to high risks of dizziness, loss of balance, and falls, especially if it's dark, with the body still sleepy and blood pressure naturally lower. This type of fall is one of the main causes of fractures, hospitalizations, and serious complications in people over the age of 70. In addition, fragmented sleep due to constant trips to the bathroom compromises nighttime recovery, affecting memory, mood, and increasing the risk of neurodegenerative diseases such as Alzheimer's. Another worrying factor is that by forcing the heart and blood vessels to deal with an extra volume of fluid in the body during rest, there is an increase in blood pressure and greater cardiac effort. For those who already have heart failure or hypertension, this overload can trigger crises and cardiovascular events. The good news is that small changes in routine can avoid this problem. During the day, drink plenty of water to ensure balanced hydration, but at night, gradually reduce your fluid intake, especially in the 2 hours before bedtime. Also avoid diuretic drinks during this period, such as coffee, black tea, green tea, or industrialized juices. If you feel thirsty before going to bed, take only small sips of water. Also keep the path to the bathroom bright and safe, with fixed mats and supports near the bed. Sleeping well is essential, and avoiding this seemingly harmless habit can mean more peaceful and safer nights. And now, get ready to know the last sign that may be warning of imminent danger. 11. The sound of death that you ignore every night. Snoring at night is seen by many as something natural, especially as the years go by. But this sound, which is often a reason for jokes among couples, can hide a serious and silent disorder, sleep apnea. And the most alarming thing is that after the age of 70, this problem becomes even more dangerous. Sleep apnea occurs when breathing is interrupted several times during the night, even for seconds. Each stop reduces the level of oxygen in the blood, forcing the heart to work more intensely. This constant stress during sleep can lead to increased blood pressure, arrhythmias, heart attacks, and even strokes. And the scariest thing is that most people who suffer from apnea don't even know they have it. It is usually the partner who notices that the person snores loudly, pauses in breathing, and sometimes wakes up choking or feeling suffocated. Studies by the American Sleep Association show that untreated sleep apnea can reduce life expectancy by up to 15 years. In addition to apnea, another dangerous sign is persistent insomnia. Having difficulty falling asleep or waking up several times during the night can be a warning that something is wrong in the body. Lack of deep sleep is directly linked to cognitive decline, memory loss, depression, hormonal imbalances, and increased heart disease. And it doesn't stop there. Poor sleep also affects the immune system, reducing the body's ability to defend itself against infection and inflammation. If you snore frequently, wake up tired, or feel excessive sleepiness during the day, it is essential to seek medical help. Performing a sleep test, such as polysomnography, can identify breathing disorders and guide the best treatment. In many cases, the use of devices such as CPAP, which keep the airways open at night, can save lives. Other measures include maintaining a healthy weight, avoiding sleeping on your back, not consuming alcohol or sedatives before bed, and creating a dark and quiet environment in the bedroom. Sleeping well is not a luxury. It is a vital necessity for physical and mental health. But there's still one more devastating habit we need to address. 12. The secret routines that steal years of your life. Many seemingly harmless nocturnal habits can slowly steal years of your life. Looking at the clock repeatedly during the night, for example, activates the brain and increases anxiety, making it difficult to get restful sleep. Bringing worries to bed keeps the body in a state of alertness, raising cortisol and disrupting melatonin production. This accelerates aging and increases the risk of cardiovascular disease. Watching television or using your cell phone before bed also impairs rest. Blue light and stimulating content keep the brain active. Nocturnal sounds, even subtle ones, such as the noise of traffic or the ticking of the clock, fragment sleep, preventing the body from reaching deep and restorative stages. To reverse this, it is essential to create a relaxation routine. Turn off electronics, practice meditation, keep the environment dark, quiet, and pleasant. Changing small habits, such as avoiding heavy meals or taking your cell phone out of the room, directly impacts your health and longevity. Sleeping well is not a luxury, it is a necessity. Take care of your nightly routine as an act of self-love. Your future with health, autonomy, and lucidity starts today with a good night's sleep.